All right, today we're going to talk about the anterior all ceramic preparation. A lot goes into this, how much you're going to reduce based on color of the preparation, translucency of the material you're going to use, whether you're going to be bonding or cementing. Opaque ceramic versus translucent ceramic plays a huge role in how much you're going to actually remove. And for this particular case, though, we're just going to go over the standard kind of board type preparation, which is a little antiquated, a little outdated. Facial view, you have about 6 to 10 degrees of taper, 1.5 millimeters in incisal edge reduction, with keeping that incisal edge a millimeter thick, very important for milled restorations to avoid overmilling. And on the facial, we have 1.2 to 1.5 millimeters of facial reduction. I tend to err more on the 1.2 millimeter side of that, especially for EMAX. 1 millimeter facial shoulder, it could be about 0.8 to 1. 2 planes of facial reduction, gingival and incisal planes, they're distinct. On the lingual, we have a little lingual wall there. This is super important, especially for cemented restorations, very antiquated for bonded restorations. But that lingual wall needs to be parallel to the first plane of reduction. Mostly these days we're doing cingulum preservation preps where we don't even have a lingual wall. It's just preserving that entire beefy cingulum. But for the old school prep, you have a lingual wall that's roughly parallel to the first plane of facial reduction, and a fossa on the lingual that's 1.2 to 1.5 millimeters reduced, once again depending on the strength of the ceramic material that you're using. And if we rotate from an incisal edge view, you could see that we have a biconcave lingual fossa. It's concave buccolingual and incisal gingivally with a convex facial. That incisal edge is a millimeter thick, once again. Super easy preparation. This is your standard board preparation. So let's go ahead and get into a little more detail here. This is just steps that I like to do. I like to make incisal edge depth cuts. This is a 330 carbide burr, roughly 1.5 to 1.8 millimeters, or what the average flutes are on a 330 burr, depending on the brand. Like I said before, you want about 1.5 millimeter incisal edge reduction. Or alternatively, instead of using a depth cut burr, you could just you should know what 1.5 millimeters, 2 millimeters is. You should just be able to go right for it. In this case, we're doing 2 millimeters here, and using the very same burr that we're going to use to generate the majority of the preparation reduction. So we can see the depth cuts in this instance are exactly 2 millimeters all the way across. That was a 847 KR016 burr. That is the burr that we're going to use then to smooth out those depth cuts. You're basically trying to make it to where you can't really visualize the distinct cuts. Being very careful not to hit the adjacent tooth, especially when you have thin films of enamel, like that little crab claw right there. Okay, so we're going to use that very same burr to create our interproximal reduction. There's no need to use a skinny little burr. You know you have to get that KR burr in there anyway, so just go for it. Stare at the adjacent tooth rather than staring at the tooth that you're working on, and you're trying to get the burr as close as you can to that adjacent tooth without touching it. It's kind of a game that you could practice being fast at it. In this particular instance, I'm taking it slow, going through in steps, but oftentimes you just could go right through and do it a little faster, like shown here. You just kind of go for it. Just like that. Don't hit the adjacent tooth. If you destroy the adjacent tooth, it'd be automatic failure. Unfortunately, there's nothing you can do to help you with that except practice. Okay, so once you have your incisal edge reduced and your interproximal rough cut, you're going to then start on your facial reduction with a 0.8 to 1 millimeter shoulder, and you're going to follow the rise and fall of the facial gingiva and keep that finish line about 0.5 millimeter to 1 millimeter super gingival for this exercise. Clinically, depending on the color of the tooth and the amount of shade transition that you want, for example, if there's a dark tooth and the patient wants a bright tooth, you have to kind of hide that finish line. We'll talk in class how to do that atraumatically and aesthetically. But for this exercise, keep that finish line about 0.5 millimeter super gingival, okay? If you hit your tissue on your typodont, that's not going to be good. I'm going to consider that an error in burr control. Okay, so lingual, same burr, and you're going to only focus on the cingulum, tissue to the cingulum area, that bottom third of the tooth. And that's the lingual wall right there that we're creating. We're keeping that roughly parallel to the first plane of reduction on the facial, that plane that you just did when you created your finish line. And I'm just really focusing on that finish line, making sure that I don't undercut that at all, because that's the number one most common error that you'll find is an undercut on that lingual wall. That also will probably result in an automatic failure for this particular exercise. So you want to make sure that you taper back that lingual wall and have it taper roughly 6 to 10 degrees in relation to that facial first plane, that gingival plane of reduction on the facial. And be really careful. You don't want to generate anything thicker than a millimeter shoulder here. It's very common for students to have a landing strip there. Be very careful of that. Switching to a football diamond now for the biconcave lingual fossa. The tip of the football goes very, very low. That lingual wall is only about 1.2 to 1.5 millimeters tall. Now we're going back to the KR burr. And we're doing our second plane facial reduction, which bends palatally, and that thins out that incisal edge. So you have to, like I said, that incisal edge has to be a millimeter thick, or else you're going to get severe overmilling with your restoration. And so that's what sometimes necessitates a shorter prep than you would really want clinically. And also these typodont teeth are fairly thin compared to actual teeth in reality. So now what you need to do is go ahead and just smooth everything. Slow that speed down to about a 7 or a 10 and really polish your preparation. You could switch out to a red stripe fine diamonds, and you're looking not to over reduce here, but just smooth what you already have. And like I said, that finish line is a rounded shoulder, roughly about 0.8 to 1 millimeter thick. First plane, second plane reduction, thick incisal edge, no sharp corners, so it's kind of rounded. And that should be about it. You're going to have a final examination with I think it's a 10-minute anterior all ceramic prep that you have to do in 10 minutes. You'll do so many throughout the semester that it'll become second nature to you, hopefully. Once again, if you need any help, come find me. I'm more than happy to sit down with you guys one-on-one. Don't be overwhelmed. We're going to prep hundreds of these, so no big deal if you don't get it your first time.